Depression is the leading cause of disability. It's a mental state. It's like a mental illness, and it exhibits behavioral traits. It does not show physical manifestation on the external like fever or like diabetes. So when you see someone going through depression, you may feel, why are they behaving like this? Or you may feel, why can't they just motivate themselves and come back? But you see, they cannot. They cannot, because it's clinical. Having depression is a lot different from feeling depressed. We've all felt depressed at some point in time of our life or not, haven't we? It's like a rainy day, it's like a bad day, it's like when things didn't happen the way you wanted it to happen and you're feeling depressed. It's like you must have come out from a movie and you would say, boy, that is depressing, because that movie must have made you feel sad or anxious or helpless, something like that. That is feeling depressed. But feeling depressed is a lot different from having depression. You see, having depression is a clinical state, and it doesn't go easily away. It stays there for a couple of days, weeks, or sometimes even more. You know, having depression is like a nice bear, a big bear coming and hugging you and taking you down. Isn't that comfortable? It is, but it stays with you. It's like the bear is with you all the time. It puts you down. It interferes in the way you think, in the way you work, in the way you study, in the way you eat, in the way you interact, in the way you do everything. That interferes. And it's clinical. So you may wonder, why do they behave like that? But you must understand, depression is a thing, and it's real. Neuroscientists have now found out that depression has begun to have physical manifestation. X-rays have shown smaller frontal lobes and the hippocampus volumes. So what really happens when depression manifests? You know, it has abnormal transmission of neurotransmitters. You see, a body has a lot of these monoamines like the serotonin or the norepinephrine and the dopamine. The volumes of these, the quantities of these reduces. There's abnormal ratios of these in the body, and this participates, because of the lower volume, into anxiety, into attention, into lack of motivation, into pleasure trips, obsessions, compulsion. Depression also gets into a zone where there are abnormal hormonal changes in the body. Like I said, depression is extremely a behavioral tool, and if you see, I'm going to tell you the different behaviors that such kind of clients show. And if you happen to see at least 5 of this happening in them on a recurring base, then I think you must take them for diagnosis. The feeling of loneliness, loss of interest, guilt, fatigueness, change in appetite, the sense of worthlessness, excessive sleeping or less sleeping, poor concentration, the ability not to focus, psychomotor agitation, which is restlessness, or psychomotor impairedness, which is slowing down, slowness, withdrawal symptoms in every way, weight gain, weight loss, and suicidal thoughts, which is like recurring thoughts of death. If there are on a daily basis, every day, if they have 5 such thoughts, 5 such behavioral traits, you must take the assistance of a counselor, a doctor, a neuroscientist, a therapist, psychiatrist. There is this client who once comes and tells me that we don't know when depression creeps in, but it creeps in sometimes and it stays. And the most difficult thing at that time is to keep things going. Another client once told me that I know there are people who love me. I know, but I can't feel it. Isn't that crippling? That is, right? Because there is no definitive tool to measure depression, and there is no definitive diagnostic tools to measure depression. So it may appear that it's okay, but you may feel that, why are they doing it this way? Sometimes it's difficult to understand who's really smiling and who's covering it up and who's struggling inside. There's one client who once comes and tells me that, I don't want your fucking advice. That was heavy, right? And she said, I want you to listen to me. I want my family to listen to me, because even I don't know what I'm going through. And yes, I understand that, because it's hormonal, it's environmental sometimes, it's biological sometimes, it's psychological sometimes. They are going through some demons. And the best what we can do at that time is listen, hear them out, without being judgmental, without tagging, without motivating. They need help. They need help, not motivation. They get irritated when you simply motivate them. They need help. Listen to them. I say, when you see people going through such behavioral trait and some challenges, encourage them gently to seek help, professional help of a therapist, of a psychiatrist, of a counselor. But in doing so, make sure that they don't slip into guilt or shame or embarrassment. That happens most of the time if you're too aggressive in telling them that. It takes time because they are also dealing with their own problems. My question, which I normally ask, is why do families take so much time in seeking professional help? Why is this stigma still there? I think that's because we don't talk openly about mental health. 1 out of every 4 person suffers from a mental health situation, and depression is the most common one. What takes so much of time for people to really seek that professional help? Depression is common. It's like a demon, it's like a bear that lives with us. We must take everything that it takes to fight it. The exact causes, like I said, is not known. It could be biological, it could be environmental, it could be physical, it could be psychological, it could be one of the many. And there are different treatments. When you visit a psychologist, a counselor, a therapist, it could be a pharmacological solution or a non-pharmacological solution. It depends whether you're having mild conditions for a long time or you're having serious conditions. But you must resolve and visit and take professional help. Depends at what stage you are. Clinical depression can be really tough for the ones who are going through it, and especially for the families who are dealing with these people. And these are the times when families come together, they bond together to form everlasting bond and support to help one another. After all, that's what families are for.